You might have heard of SIBO, small intestinal bacterial overgrowth, but how do you know if you also have fungal overgrowth, aka SIFO? Welcome back to my mini series. My name is Dr. Gonzalez. I'm a naturopathic physician, and I will be breaking all of this down. Unlike SIBO, there is a great diagnostic tool to determine if you have SIBO, the lactulose breath test. SIFO does not have an awesome, strong, specific, and sensitive test. The reason being is because the fungus, Candida, which colonizes the small intestine, is ubiquitous, meaning it's found all throughout our GI tract. There isn't a set standard cutoff to determine when you have too much of this fungus in your gut. So it's not as easy as doing a stool test to determine if you have fungal overgrowth because, of course, some fungus is going to show up in there. And with the blood tests such as Candida albicans, IgG, IgA, IgM, Candida immune complex, lately I've been shying away from doing these tests because it really just shows immune exposure, meaning at some point there was maybe Candida, even if you had yeast infection months ago and your immune system is responding to that. It's not really indicative of a current active infection, and you should never use it to track treatment progress. I've learned from my mistakes. Instead, you have to use clinical reasoning and a diagnosis of exclusion to determine if there is SIFO going on. You technically could do an endoscopy and culture the small intestine for fungal and bacterial overgrowth. Let's be honest, a lot of GIs aren't going to be willing to do that. The way that I approach a SIFO diagnosis is the following. First, look at the symptoms. Of course, with SIFO, there's a lot of overlap symptoms with SIBO: bloating, gas, diarrhea, constipation, pain. But usually there are other telltale signs that there's SIFO going on. These symptoms, for example, chronic recurrent yeast infections, oral thrush, rashes on the skin, dandruff, sugar cravings. These are all some signs that can point to that. I want to ask about recent or frequent antibiotic exposure because we know that antibiotics can create an environment for Candida to overgrow. Also, if the patient has SIBO already, there is a high chance that they might have SIFO as well because the same root causes that contribute to SIBO can also contribute to SIFO, such as low stomach acid, maldigestion, poor gut motility. In fact, 20% of patients that have SIBO also have SIFO. But here's the thing, I don't always jump right into SIFO treatment unless they have pretty much all the signs: antibiotics exposure, oral thrush, chronic vaginal yeast infections. Then yes, I am going to also incorporate some type of antifungal, whether it's liquid nystatin or fluconazole. But if those other symptoms aren't there, what I'm going to do is attempt to treat the SIBO first with herbal antimicrobials or elemental diet. I'm going to treat that and see how they respond to the treatment, maybe repeat the SIBO test. If the repeat SIBO test is negative, but they're still symptomatic, then that might make me want to treat for SIFO because, again, they're still symptomatic. Maybe